All right, I think we're going to go ahead and get started. So I just want to welcome everyone for joining us here today. Thank you so much for joining. We are excited to have you here today. My name is Robin Al-Haddad, and I am the Community Manager for QualME, which is Ideal's Qualitative Monitoring and Evaluation peer community. And I'm happy to welcome you all to this learning session on designing qualitative research. Before we get started, I just want to inform everyone that we are providing French interpretation today. So during this meeting, please click on the globe, the interpretation globe at the bottom of your screen, and select your preferred language of English or French. Unfortunately, the interpretation feature is not available if you are connected from your phone. Also, when we break into small groups later on, we will have a French-speaking breakout room. And so if you have indicated that French is your preferred language when you registered for this event, then you will automatically be assigned to the French breakout room. Otherwise, my colleague Bella Gerthafer, who is our technical lead today, will be able to support your needs. This is a peer community, so we would like to get to know each other better. So please go ahead and introduce yourself. I see many people are doing that. Introduce yourself in the chat. Please share your name, your organization, your position where you're based, and put your responses into our chat. Today, we will hear from participants from Ideal's Qualitative Research Learning Lab, who will discuss how they applied learnings from their learning lab to design and implement a qualitative study for their activity. The Qualitative Research Learning Lab is a capacity strengthening opportunity that was hosted by Ideal to expand learning on qualitative research, design, data management, analysis, for both emergency and resilience food security implementers. Our 2024 Learning Lab cohort engaged for 2 months in 2 online self-guided e-courses. They also participated in a live session that was facilitated by Gaia, the Gender and Youth Activity, on using qualitative methods to increase gender equality and social inclusion. And they engaged with Ideal's team of qualitative technical experts over the course of about 4 months to support the design of their individual research protocols in preparation for a qualitative inquiry for their activity. We have a few announcements. You can check out Ideal's qualitative M&E e-courses online, including one on designing qualitative research for M&E and another one on qualitative data management and analysis. The link will be shared with you in the chat, and there's a QR code here as well. Also, just a quick reminder of a few basic house rules. Please remember to keep your microphones muted when you are not speaking so we don't hear your background noise. You can also use the chat box or the raise your hand button if you have a question, and we will try to call on you, and we will try our best to answer as many questions as we can in this short amount of time. If your bandwidth allows, please also turn on your video when you are speaking so we are able to see you. But if your bandwidth doesn't allow, you can also turn it off. That's fine. We will be recording this session. We are recording, and we will send out the link for the recording after this event. Each of our QualME sessions has a different topic of discussion, and today we are focusing on designing qualitative research. And this meeting is intended to just give a very brief overview of your design challenges and best practices used in study design decisions. So for our agenda today, first up, we will hear from our colleagues from CARE Zimbabwe, who will talk about using qualitative methods to enhance the understanding of the Takunda RFSA income generating activities. And then next, we will hear from Mercy Corps Kenya on how they designed a qualitative study to assess the Nawiri RFSA social behavior change interventions. So thank you all for joining us today. And then after the plenary session, we will then break out into some small groups for individual discussions. So stick around for that. All right, so now we are going to turn it over to CARE Zimbabwe, the CARE Zimbabwe team. First of all, we have Rumbazai Matemba Matusa, who works with collaborating, learning, and adapting CLA. She's the CLA lead with USAID's Takunda RFSA at CARE Zimbabwe. Rumbi is a research methods, learning, and adaptive management practitioner who aims to improve effectiveness of development research while generating and providing usable information, promoting learning, and informing sharing. Rumbi successfully secured funding from multiple institutions for capacity building in agriculture as part of initiatives aimed to enhance the quality and relevance of research development. And her findings have significantly contributed to several scientific publications. In Rumbi's past role, she worked to advance research for development in sub-Saharan Africa as well as Latin America for the past 15 years with international NGOs, universities, and government ministries. We also have with us today Obert Chikochi, who is the Livelihoods Advisor for the Takunda RFSA. And in his role, Obert drives Takunda's off-farm livelihood strategy, supporting resilience and food security capacities among vulnerable communities through promoting diversified livelihoods, providing technical guidance in enhancing the participation of youth in technical and vocational trainings, life skills, and community village savings and lending schemes. Obert has been in the development field for over 21 years, with CARE International and with Swedish Cooperative Center and various other projects. Obert holds a Master's in Development Studies from the Midlands State University in Zimbabwe. And finally, we have Tanaka Chitsa with us, who is a communications specialist with 8 years of experience in both the development and humanitarian sectors, working with multiple projects which were funded by the Australian Development Agency, the European Union, GIZ, UNHCR, World Food Program, and the United States Embassy in Harare. Tanaka has also contributed to various Southern Africa Development Communication commissioned publications. As our CARE Zimbabwe team are presenting, feel free to write your questions in the chat. Our speakers will have an opportunity to answer your questions after both presentations have finished. Okay, so now over to you, Rumbi and team.
Thank you, Robin, and hello, everyone. I will be co-presenting this work on behalf of the Takunda team. Next slide, please. So here is an outline on what we will discuss. Next slide, please. Here we provide some information about Takunda RFSA, which is delivering a multifaceted set of interventions designed to address the complex nature of poverty amongst rural households in Zimbabwe. Next slide, please. We begin with a few challenges we faced conducting the qualitative research, all here listed, and maybe I can talk about just one: limited technical capacity, something that we really need to invest in to make sure that we are able to get the most out of the studies, the qualitative studies which we conduct. Next slide, please. So here, we decided to show the journey that we progressed with as Takunda. So we didn't wake up one morning and decide to conduct qualitative research. Careful thought was put into the entire process, our conversations internally as staff and externally with program participants, referring to indicator data led us to conduct desk reviews, consult source documents, identify evidence gaps, and subsequently design the exploratory research. So one of the interesting things we shared in our annual results report was just seeing our participants engaging in more IGAs as compared to the situation in the past when none of them were, or when they were engaging in only one IGA activity. Next slide, please. So this is the purpose that we decided to define for our qualitative inquiry. We needed to make sure that we understand where we can provide further support and strengthen the establishment of IGAs. Next slide, please. These are the objectives that were in line with the groups of participants we were engaging. So we decided to talk with participants who were able to successfully apply for funding the startup kits, and those who were not able to, who didn't make it to obtain this funding for the startup kits. So these were the two groups of people we decided to engage in this qualitative research. Next slide, please. Consequently, these are the highlighted objectives we decided to explore. So we decided once we have this in place, once we have our participants discussing this, we may be able to achieve the objectives that we had. Next slide, please. Now, looking at the sampling strategy, we decided to adopt purposive sampling, and we employed the sampling strategy calculator, which helped us to have subpopulations of interest. In this case, there were two parts: those who did receive startup kits and those who did not receive startup kits. We also had two attributes to focus on: the location or district, and also the type of IGA a participant was engaged in. We had two data sources that we decided to focus on. So that was FGDs and IGIs, because we wanted to get in-depth information from these participants as they shared their perspectives. So we ended up doing both FGDs and IDIs. IDIs targeted our technical vocation, education, training students, whilst FGDs focused on the groups like VSLA groups, which came to give us their perceptions. Next slide, please. So I will talk about a bit about the data collection, management, and analysis. Next slide, please. So this is how we handle the processes of data collection, data management, and analysis. Looking at the top box, which is slightly to the left, these are the tools which were key for us to be able to plan our work, to be able to execute our work efficiently. And I must say that reference to the USAID BHA Qualitative Design Toolkit was a plus for us. Just going through that, it was very helpful. We had MX Excel and Atlas TI to analyze our data. That was extremely helpful as well. And some of the things that helped us to achieve our goals and complete this work was just collaborating as staff internally, with our peers externally, with the communities, local leadership. There was an intensive planning and consultation, and this was very helpful. Next slide, please. I would like to leave at this point, this time, to my colleague Obert, who will present on our results. Thank you, and over to you, Obert.
Okay, thank you, Rumbi. So in terms of the results after the assessments, we discovered that the process of distributing the startup kits was made quite simple as compared to when the beneficiaries were accessing external finance. It is because accessing external finance normally requires a lot of paperwork, but because of this process, we managed to make the whole process become very simple. And also, the majority of the IGAs that we supported were seen to be much viable, as we have seen people having an increase in income. There was also evidence of diversified income sources, where people were venturing in different, a range of 2 to 3 income generating activities. However, we have also noted that in as much as people were venturing into different IGAs, there still exist some barriers in terms of hindering people to participate in IGAs, such as stringent regulatory processes, the need for them to register, the need for them to have paperwork. I think those are some of the key findings that we got from this survey. Next slide. We also learned 2 basic things that before an organization or any partner distribute startup kits to participants, there is need to conduct a vigorous training on entrepreneurship and financial literacy, as this could give people enough knowledge, confidence, and change their attitude and behavior towards the utilization of the finance. And also, during the distribution of startup kits, we discovered that there is need for an intense monitoring and physical verification before you distribute the startup kit, so that you identify the outliers, you also identify the different participants who would have cheated in the proposal writing process. Next slide. Then Takunda is also going to use this information to adopt 3 main areas. Next slide. I think one of the key area that we're going to use this information is on targeting. We have discovered that most of the groups that were doing village savings and lending, they have startup capital for themselves through their village savings and lending. And startup support is very key to youth who are actually in TVETs, who don't have any startup capitals. We also discovered that for those participants who did not receive the startup capital, it was possible for us to also link them to external financiers. And of importance is we are also going to use this information as we intend to scale up the intervention. I think those are the 3 basic adaptations that Takunda is going to make. Thank you.
All right, great. Thank you so much. Yes, thank you, Rumbi, Obert, for sharing your overview of your qualitative research. Next up, we are going to hear from Charles Aurora and Joshua Lewindi from Mercy Corps, Kenya. Joshua Lewindi is the acting M&E lead at Mercy Corps, Kenya, USAID Nawiri RFSA. He has over 13 years of experience in designing and implementing MEL systems across health, education, agriculture, and food security sectors. Joshua holds a Master's of Science from Asento University and a Bachelor's in Computer Science from Egerton University. Joshua has led monitoring, evaluation, and learning MEL activities for major USAID-funded projects, including Nawiri and the Ifaya T. Miza, focusing on data quality assurance, capacity building, and collaborative learning. His expertise spans both quantitative and qualitative research. We also have with us Charles Aurora. He's a social behavioral change advisor at Mercy Corps on the Nawiri RFSA. Charles holds a PhD and a Master's of Science in Disaster Management and Humanitarian Assistance. He is currently finalizing his Master's of Public Health at Liverpool John Moores University. And previously, Charles worked for Population Services International, Medical Emergency Relief, and Action Against Hunger. He has 15 years of experience in designing and implementing social behavioral change interventions that are related to maternal and child health, nutrition, WASH, and the humanitarian relief sector, as well as a deep understanding of human-centered design and behavioral models for creating resilient solutions across 9 African countries. All right, so now as Charles and Josh are presenting, please feel free to write your questions in the chat box or use the raise your hand button, and our speakers will be able to answer all questions at the end of this presentation. Thank you, and now over to Charles and Joshua.
Thank you, Robin. I think I'll go first, then Charles will follow. Just to start, you said Nawiri RFSA is an 8-year funded program implemented in Samburu and Turkana with a total of 140 million USD as a budget. Lead implementer is Mexico with 3 other partners. And our main goal is to sustainably reduce persistent acute malnutrition in Samburu and Turkana. Next slide, please. Yeah, that is the overview of my presentation. Yeah, it's just like what my colleague has also presented. I'll just go into the context. Next question. Next slide, please. Next slide. Before our joining Qualitative Lab, this is how our monitoring looked like. Yeah, it was purely quantitative, a little trial on qualitative, but capacity was limited, and this particular lab was very helpful for us. Next slide, please. Next. Yeah, in designing our QI, in designing our program, we mapped desired behavior across all our participants and designed our interventions, and we knew very well that if we do this, this will happen. But that did not happen, and that is why we are doing this. Yeah, despite doing all we said we would do, the behavior does not lead into the desired results that we expected. Next. Yeah, we sat down to identify the gap through review of data, keen look at the indicators, looking at the logical framework, theory of change, just the pathways to see if there is anywhere we needed something, or if there is anywhere we could make the house and the why the results are not as expected. So we found out that we have to do a qualitative inquiry to be able to answer those questions. We were not getting the answers that we expect to describe or to explain the results the way they were coming out. Next, please. Yeah, so the purpose of our inquiry was just to investigate behavioral, contextual, and systemic barriers affecting adoption of the desired behavior as we envisaged from the word go. Yeah, and we picked promoted WASH behavior and consumption of diversified and enough food by our participants as the 2 behaviors we were investigating. Next slide, please. Specific objectives was just to look at specific behavioral challenges preventing adoption of these behaviors. Also trying to look at the context, what might we have missed as we were starting, and also systemic factors, what could we have missed during design to be able to help us refocus and redesign our SBC intervention, and also what the participant perceive our intervention as, to be able to adapt and improve for better results. Next, please. So these were the 3 questions we were asking ourselves, and we were yearning to answer through the process. there is opportunities and constraints in adoption of those desired behaviors, and taking a look at barriers to access, and also specifically how effective are our SBC interventions out there to be able to find out the gaps that we might have missed to improve our interventions. Next. Next slide, please. Yes, our study design was a qualitative exploratory research, just to gain insights into behaviors, context, systemic barriers to health services utilization and adoption. Focus was to understand perceptions, attitude, and experiences related to promoted wash and nutrition behavior. And next slide. Yes, to be able to answer this, we designed our inquiry around 2 methods of data collection. Initially, we had an array of so many methods to use, but through consultation during the lab, we settled on these 2 FGDs just to help us gather diverse perspectives and understand community norms and KIIs to obtain in-depth insight from professionals and stakeholders that we implement, along with, to be able to explore systemic factors, contextual factors affecting our intervention per se. Next. We also use purposive sampling to be able to be specific on who do we want to talk to. Yeah, initially there was an array of people to talk to, but as we continue with our discussions, we narrowed down. I will tell you when I flash out the sample size, how the process looked like, and from that sample we determined how many. There is one thing in qualitative inquiry, there is one thing to decide who you want to interview. And there is also another how many you want to interview and how much is enough, how much is good enough to tell you something. I think the process led us through an informed way to select through and settle on a number. Next, please. Yeah, this is how our final sampling looked like. But initially, our first iterations gave us 84 FGDs plus KIIs to conduct. But as we continue with our discussions, interrogation, and all that, we scaled it down to 27 and 12 KIIs. That is giving us a total of 39 from 84. That was a very helpful process that helped us zero in into what do we want. Yeah. Next, please. I'll leave it to my colleague Charles to continue from here. Charles, over to you.
Thank you, Joshua. I'm going to take you through the challenges, and one of the significant challenge we encountered was conceptualizing and prioritization of social behavior change qualitative evidence gap. And the other one is how to the saturation level, the number of participants to give us the optimum feedback that we required for the inquiry. And one of the other challenge was framing and ranking qualitative inquiry questions. We had a set of so many standard questions, narrowing them down to what was expected of us was quite cumbersome. Then the other one was time constraints from participants. Participants had a series of competing tasks, despite the fact that we informed them early and they had agreed to participate in the activity. Next. Then The other challenge was recruitment of participants. Some of them we had to do prompted a callback. Some of them were missing. Then we had several external contextual interruption coupled with high expectations from the participant who wanted token of appreciation, allowance for sitting in the discussion. Then the last unique one was whereby we had dominance of some participants who appeared both in focus group discussion and key informant interviews, and others wanted to appear in multiple focus group discussion, which we had to have a remedial action for that. Next. From this qualitative inquiry, we as much as we have not finalized our data analysis, we were able to pick some key insights, key learning points. Next slide. The first one was the room for contextual insights. We were able to internalize, revisit the issues of environment, social and cultural factors and how they influence our priority programmatic behaviors. Then we had also an opportunity to pick, to gather insights, the perspectives, the revised, the renewed desires of the program participants, feeding into the how and why. Then the program also gave us insights to the need for more enhanced integration of activities in the specific sites. Then lastly, the further acknowledgement of complexity of key priority behaviors, how they are influenced by an array of factors, some that are not directly within the control of the program. Next. What also we picked, and that is quite significant even into our future endeavors, the diversity and inclusion, plus prior experience of the research assistant into our programs, geographical locations, understanding of local audience, the local language was a success factor for us. The exercise went on smoothly. Then the entire activity provided an opportunity.
I think we lost Charles. Joshua, can you step up?
As I finish for him?
Yes, please.
Yeah, the last slide. Yeah, so on application, I think as you said, Nawiri, Masiko, we have through this lab we will engagement and building trust among participants. Yeah, I think that is where we end our presentation, Robin.
All right, thank you so much, Charles and Joshua, for sharing that overview of Mercy Corps Kenya's qualitative study. We do have a few minutes now for questions. So if anybody has questions you would like to ask our presenters from both presentations, feel free to go ahead and raise your hand, or you can ask your question in the chat, and we will try to answer as many questions as we can. I'll give it a few minutes, see if anybody has questions. All right, I see one question in the chat about what tool have you used to analyze qualitative data? Either team can answer that question.
Thank you.
Yes,
So from the Takunda team, as I presented earlier, it was a mix of combinations. We had Microsoft Excel and Atlas TI. So Excel helped us to manipulate some of that data. And then when we went to the actual analysis, coding, extracting things, we were able to use Atlas TI. Thank you.
yes. As for us, I think also Excel and MaxQDA, Excel matrix helping us to capture daily insights as we review what has come in, and then we are moving into analysis using MaxQDA just to be able to finalize our analysis. Thank you.
All right, I see there's a hand up from Patrick. Go ahead, Patrick. Patrick, you're on mute. Okay, Nestor, I see your hand is up. Go ahead.
Okay, good morning. I just want to ask, because I saw that they presented, one of the group presented a chart using bars. My question is, how useful is just translating qualitative data into quantitative data? Because we cannot generalize qualitative data outside of the context. So that is something that I would like to know, why we are just doing that, or that is something that is good to do.
Thank you, Nestor. And I think you realized that for that chart, we were talking about numbers. So these were counts, actually. These were the number of focus group discussions from which participants voted for a certain perspective. So we can use charts when we have that kind of data. So we had these counts, the number of focus group discussions. That's why we presented them in those charts. Otherwise, yes, we did have the codes, and we also had visualizations. We just couldn't present everything, all of this qualitative visualizations in this presentation. Thank you.
Okay, but we need to be very careful in interpreting that, because that graph is only telling you this focus group discussion. We cannot generalize this information outside the context. Is that correct?
Thank you, Nestor. So we haven't been generalizing. Actually, at this point in time, we are simply presenting what these participants have shared as their perspectives. So thank you very much.
Okay, Patrick, are you able to come off? Yeah, okay.
Yes, I'm okay now. Hello, everyone. I'm Patrick. I'm a student of Emory, studying Masters in Development Practice with Monitoring and Evaluation concentration. So I have a simple question to any of you who would want to answer. So aside collecting data from the community or your participants, how do you engage your community in the evaluation process? Not just collecting the data, but how do you engage them or take their perspective in the evaluation that you are doing? Like, what is their participation, not just only on the collection of data from them, but their inputs in your evaluation process, not just evaluating the data that you've collected. So you go to the field, collect the data, and then you go back to the office to analyze. I just want to know the role they play in your evaluation process aside the data collection. Thank you.
Thank you, Patrick. So I'll just go first. So looking at this IGA's inquiry, we've just finished as Takunda program. We haven't yet really gotten back to the communities to discuss some of these results. But I'll give you an example of one study, qualitative study we just completed, which was just looking at tracking the incomes and expenditure of these households. So we had these monthly end of month meetings where we would be showing them the incomes they've reported during the course of that month. So we calculate what was getting into a household. It could be in kind, it could be cash, just trying to verify with them, is this really what this household of 4 people received or obtained as income? So they would verify, yes, that's what we received. So we had to engage them a lot to be able to understand some of these figures, the numbers they provided, and also to understand the shocks and stresses, the barriers to these incomes, to obtaining sufficient incomes. So I think we need to strike a balance as we obtain this data from them. We need to be able to discuss the findings with them. We need to be able to engage them in the process of making sense of the results. Over.
Joshua, did you want to answer that question too?
Yes, I think these are not just research respondents only. They are our participants we interact with on a day-to-day basis in terms of trying to ensure we increase their food production and also consuming. So in packaging this, it is like a story of where are we and what are the challenges that we could they have in terms of adoption of desired behaviors to help us. So it is not just asking questions, but packaging as a process to help us improve so that we see them consume what they produce. Like the data says that we have increased production and they're not consuming. We don't know why. So it is just like a discussion to get insights from them. And they have to understand that it is this evaluation, all this exercise we are doing is for the sake of improvement in terms of service delivery, in terms of going towards the desired behavior. I think that is it. It is not packaged as what do we want to get from you and we are analyzing for the sake of reporting, but analyzing for the sake of coming back to them and redesigning our behavioral intervention to see the desired behavior we want to see in them. Thank you.
Okay, I did see Charles's hand up. Go ahead, Charles.
Thank you. I would like to respond to Michael Monteiro, if I got the name right, where he asked about if we used any theoretical model. The design of our focus group discussion and key informant interviews, the entire study was anchored on the socio-ecological model, which looked at the various levels, that could be barriers or facilitators of adoption of the desired behavior. Thank you.
Yeah, thank you. Okay, we have one more question. Okay, sorry. I see Mabrika, go ahead. Did you want to say something?
Me?
Mabrika?
Yeah, okay.
Yeah.
Yeah, just to add something on what Lwindi and Charles were saying on the question on related to evaluation, we have our community accountability response mechanism, whereby we always have those contacts within our villages that we operate. So anytime they have any feedback related to our program, they will directly post it either within our WhatsApp. We have a free toll calls. So using that feedback mechanism, we also they also evaluate our interventions. Also, for all our participants, specifically the locations that we have targeted, we have done what we call SIAP. SIAP is community integrated action and assessment and action planning, whereby the community themselves decides specifically among our projects, where do they feel that Nawiri will chip in and support them. So before we even intervene, we already know that these are the priorities that have come from the community, and using that assessment, they also evaluate by comparing how they were before Nawiri intervened. Yeah, thank you.
Okay, great. Thank you. We are running short on time. I do see Obert and Charles, you do have your hand up I think you want to respond as well.
Yes, yes. Okay, thank you. So under Takunda also, we have got the community-led monitoring and evaluation team, which is a team formed at community level. So whenever we conduct such surveys and researches and we've got feedback, we channel the feedback to these communities for them to further disseminate the findings to the different local service providers that we work with in the project. Thank you.
All right, Charles, did you have anything else you wanted to say? Otherwise, we do have to wrap it up on the questions. I'm sorry, I see a lot of really, really good questions in the chat, but we are going to go into breakout rooms soon. And hopefully when we get in those rooms, you all can talk and chat amongst yourself. But Charles, go ahead.
Thank you. I wanted to respond to James about the use of qualitative data in storytelling. Yes, actually we have been trying, but through this qualitative inquiry, we got more insights to contextualize our socio-cultural aspect. And one of the plans we have is which is a form of storytelling, because our communities utilize a lot of local songs in almost all events, however small they are. Now it's to use the emerging themes to work with the local community-based artists to craft songs around our priority behaviors. Thank you.
All right. Well, thank you all so much. I see so many good questions in the chat. I really, really wish we had time to get to everyone's questions. Unfortunately, we are just running short on time. So we are going to go now into our breakout groups. So I'm just going to give some quick explanation of what we're going to do into these breakout groups. So we'll go to small group discussion. We will take about 30 minutes to go into our groups and discuss some qualitative research design challenges. We are a community here, and we really want we want to create a safe space for communication. We encourage you all to please talk to each other and, talk about your experiences in the breakout room. So we're hoping this meeting will give you time to do that, to make some connections with other M&E colleagues. So you are going to be randomly assigned into a breakout room. Unless you specified that you are a French speaker, then you will automatically go into the French breakout room. Otherwise, everyone will be randomly assigned into a breakout room. A message will pop up and let you know which room number you are going to be in. You click join the group. And once you get into your groups, we have a few discussion questions we'd like you to talk about. First question is, what challenges have you faced in your program or activity in designing, planning, and conducting qualitative research, and how have you tried to overcome those challenges? The second question is, when using qualitative approaches in your work, did it require any change in your staff mindset or any new ways of thinking or operating? And finally, how has your team dealt with any biases in the qualitative research that they conducted? So please also try to remember to assign one person in your group to take notes. We have some note documents that we will share with you. And if we have time at the end of our breakout rooms, we will try to do a quick report out of our top 2 or 3 key discussion, things that we discussed in the breakout rooms. All right, so we will see you all back here in this main room in 30 minutes. Let's go have a good discussion, everybody.
To come. Charles mentioned that the subjectivity of the enumerators was a challenge that they faced, and they dealt with that by trying to bring in neutral people, not necessarily experts in that particular field, but people who didn't have preconceived ideas about it. Confidentiality was another issue, and that always make sure that you don't ask sensitive questions in focus group discussions, and that you save that for the informant information. In terms of question 2, I can't really read my notes.
That's all right. That's all right.
The composition of the team was really important as well, and how you compose the team. And yeah, so we had a great discussion, and I'm sorry that I didn't do it full justice.
All right, that's fine. Tripura, I'm going to ask you quickly to report out on our room 3. And unfortunately, I don't think we're going to have time for all the other groups to report because we need to wrap up. So I'll hand it to you, Tripura, real quick.
Absolutely. Yeah, some of the challenges that folks discussed in our discussion group included managing the finances and the budgets in a process, designing the study, what needs to be measured versus what you prefer to measure. And then another major takeaway was to not exclude the program team when designing the qualitative process, the research part of it, and including stakeholders. And also fully classifying and organizing your questions.
Yep.
Another concern or challenge was the limited number of project staff who actually have the applied or practical experience in qualitative research, as well as language barriers. And then another, I guess, with the second question, we talked about how important it is to be communicative. And making sure that while you have that change in mindset, you also can, consider how the questions change. And with qualitative data, there's more probing and expanding the question, etc. So really making sure you dive into that aspect. So
Great. Thank you. All right, I'm sorry we don't have time for all the groups to report out, but I just hope you all learned something new today. And thanks everyone for this great conversation. To our presenters, Rumbi and Obert and Tanaka, Joshua and Charles, we greatly appreciate you taking your time to share your knowledge with our community. And we also, thank you to everyone who helped in the breakout rooms as well. Thank you to Bella, who's been our technical lead today. It's really important to have these good exchanges of good practice. And so it was a good conversation. Unfortunately, we have to wrap up today, but for one final thing, I would really like you all to please just take this evaluation survey. We have a follow-up link that's been posted in the chat for a survey that a short survey about today's event. This helps us kind of enhance our future events and make them better. We'll be sending out a follow-up email in the next few days with all the materials from today's event, including the recording of today's session, the slide decks, and any other resources that were highlighted by presenters. So, and finally, please be on the lookout in the FSN newsletter for upcoming events around the QualME series. We can also continue the conversation on LinkedIn. We now have a group on LinkedIn that you're welcome to join, and we'll post that link into the chat. Thank you all for joining us today. I hope you have a great rest of your day, and thank you. Bye.